Hello guys, welcome back to our channel Pharmacology. Today we are going to discuss about the mandibular nerve, and in the mandibular nerve let we discuss first about from where it has originated. The mandibular nerve, as we all know, there are the ganglions, and the ganglion supply three fibers. The trigeminal ganglion Trigeminal ganglion supplies three fibers from the upper division, that is the ophthalmic, and through the orbital fissure, and the V2, that is the maxillary, and now main branch is the mandibular, which we are going to discuss today. The mandibular nerve, after arising from the inferior part of the trigeminal ganglion, it enters into the foramen ovale. Now the foramen ovale, after coming out of the foramen ovale, but one thing we must remember, that it is containing the sensory fiber, because trigeminal ganglion gives three fibers, that is sensory, that is V1, that is ophthalmic, V2 maxillary, and the third, that is the mandibular. They are the sensory. In the upper pontine area, there is situated a nucleus called as motor nucleus, and they relay a sensory fiber. They relay in the upper pontine area. They relay a sensory fiber. ठीक है? They relay a sensory fiber, motor fiber, which enters into the foramen ovale and comes out as a single trunk into the mandibular, and joins the mandibular division and comes out as a single trunk. Now from the main division of the trunk, it get divided into the three branches. With anterior 2 branch and the posterior 1 branch. But one point needs to be remembered, that in the middle cranial, in the cranium it gives a branch. That is meningeal branch. Let me decide where it goes. The meningeal branch goes upward along and enters the foramen spinosum. Enters the foramen spinosum and supplies the dura mater of the cranium, and also supplies the mastoid air sinus. DM और mass को supply करता है. Now comes to the lower part. Now comes to the medial pterygoid. Then also gives a branch, medial pterygoid nerve, which is motor in nature. This is sensory in nature. Now the medial pterygoid, which is motor in nature, it will supply the medial pterygoid muscle, because all we know in the trigeminal ganglion, already discussed with you, that the nucleus of the motor nucleus supplies all the muscles of mastication. Medial pterygoid muscle is a muscle of mastication supplied by the motor nucleus of the trigeminal nerve, that is medial pterygoid nerve. Okay. One thing also I left is, it is called nevus spinosus, which is the meningeal branch, because it enters the spinosum, so it is called as nevus spinosus. Okay. Now come to the another point. Okay, let me write about the medial pterygoid nerve, MPN. It will supply, the medial pterygoid nerve will supply into the medial pterygoid muscle, tensor veli palatini, tensor tympani. Okay, TT. Okay. Now the branches from the anterior division is going to supply the muscles of mastication. Okay, runs downward and forward, supplying the muscle of mastication to the cheek, buccal mucosa, and the mandibular molar. That is one thing The anterior division of the mandibular nerve will go and supply the provide the motor innervation to the muscle of mastication, sensory innervation to the cheek, buccal mucosa, and mandibular molar. Now, you must be thinking, how, sir, how you can say they supply, and please make a diagram. Okay, let's see. The anterior division of the smaller anterior division, which is smaller in nature, they run. Okay, think this is the lateral. This is the anterior division. Okay, this is the anterior division. They run medial to the. This is lateral pterygoid. Okay, lateral pterygoid muscle. Okay, they run medial. Anterior division runs medial to the lateral pterygoid muscle and reaches onto the external surface of ramus of mandible. External surface of ramus of mandible by passing through the two heads of the lateral pterygoid. These are the two heads. Think of, I am not going to make a good diagram. Guys. And binding on the upper head of the lateral pterygoid. I am just visualizing you that the upper head of the runs medial on the lateral pterygoid by between the two heads of the lateral pterygoid muscle and binding onto the upper head of the lateral pterygoid muscle and comes on the external surface of ramus of mandible, and this is what? This is the buccal nerve. This is the buccal nerve. Now the buccal nerve will get divided into the two part, that is the temporalis and the mesencephalic or lateral pterygoid nerve. The temporalis. This temporalis, let's see how it enters and what is its course. I'm not going to make the proper diagram because this is just for the illustration so that you can understand. So the lateral pterygoid nerve, the buccal nerve will go and divide into the two branches, that is the temporal and the lateral pterygoid. The temporal, remember one thing, the temporal emerge on the anterior surface. This is the anterior surface. Okay, the temporal will emerge on the anterior surface of ramus of mandible because the temporalis muscle is joined on to the coronoid process and the on the anterior border of the ramus of mandible. So it will run into the anterior border of ramus of mandible and supply the temporalis muscle. Okay, emerge on the anterior border of now supply the temporalis muscle. One thing need to be remembered, since it has branch, that is mesencephalic and the lateral pterygoid nerve, the mesencephalic will come onto the ramus of mandible and will supply the masseter. Okay, will supply the masseter. Then it will continue. Then तो क्या हुआ कि यह मैसेटर पे एंटीरियर डिवीजन पे आया और सप्लाई करके मैसेटर को सप्लाई किया, एंटीरियर बॉर्डर ऑफ रामस ऑफ मैंडिबल पे गया और एंटीरियर बॉर्डर ऑफ रामस ऑफ मैंडिबल को भी सप्लाई कर दिया, मतलब टेम्पोरल को भी सप्लाई किया. नाउ कम्स द एंटीरियर लेटरल डायरेक्शन एंड सप्लाई द मैंडिबुलर थर्ड एंड सेकेंड मोलर. Mandibular third and second molar. Also, it crosses the front of ramus of mandible and enters the cheek area, that is here is something called a mouth, and it will enters into the cheek area. It will enter into the cheek area, so and by entering into the buccinator. So this buccal nerve is also called as the buccinator, but one thing must be remembered, that it does not supply the buccinator. Never remember that it supplies the buccinator. People think that they supply the buccinator. What was all these things? They all were the motor division of the mandibular nerve. Now the sensory innervation, this what we are going to discuss. After entering into the anterior lateral direction, they enters into the cheek. This is the sensory innervation. Okay, this is the sensory innervation. Means buccal nerve is completed from my side. Very little amount is left about the sensory innervation of the buccal nerve. So let first finish, that is their fibers. The first what we have discussed, which supply, I will make you remember everything. Let me discuss about the other fiber which passes through the retromolar triangle. The retromolar triangle, after entering into the retromolar triangle, here when you see the cast of mandible, I am not good into the diagram, so please take it. Yeah, these are the okay. These are the retromolar triangles of the okay. So after entering into the retromolar triangle, they supply the sensory innervation to the, since it enters into the mandibular molar, so the gingiva will be there, so it will supply onto the inner aspect of the gingiva. Okay, that is buccal outer aspect of gingiva, that is buccal gingiva, and also the mucobuccal fold into the region. Okay, so they will supply the mucobuccal fold. Now first comes and let come and discuss whole about the mandibular, that is buccal branch. So we will complete our two branches of the mandibular division. So the last division, that is posterior, very longest branch, we will discuss later. See, this is the pontine area. Here it is the in the petrous part of the temporal bone, the trigeminal ganglion will be situated, which will supply the from the upper aspect to the superior orbital fissure, that is V1, that is ophthalmic division of the trigeminal ganglion, ophthalmic division of the trigeminal nerve. Now from the middle it supplies the V2, that is maxillary nerve. It will comes out of the foramen rotundum. Then comes then comes the inferior then from the inferior portion comes the mandibular nerve MN, and it will goes into the foramen ovale. It will comes out of the foramen ovale or enters the foramen ovale. Okay, but at the same time there will be motor nucleus that will be supplied by the and enters the foramen ovale, and the motor nucleus motor nerve will arise, and they will supply all the muscles of mastication, that is motor innervation. After entering into the foramen ovale, these two nerve nucleus joins with each other and gives a branches in the cranium, that is meningeal branch. The meningeal branch enters into the foramen spinosum, and foramen spinosum, this is foramen spinosum. Okay, and they will supply the dura mater and the mastoid air sinus. Okay, I am going fast because I have already discussed it in detail, so you can understand what I am saying. So they supply the dura mater and the mastoid air sinus. At the same time, a branch is arising from the main trunk, that is that is called as the medial pterygoid nerve, and they will supply which is motor in nature. This is sensory component, and from the motor component medial pterygoid nerve will arise, and it will supply the medial pterygoid muscle. Okay, medial pterygoid muscle, tensor veli palatini or tensor tympani. These are the muscles of mastication and the tensor tympani in the ear it is found, and these are some innervation in the cranium. Now in the main trunk goes further, and it divide into the two branches, that is anterior and the posterior. The anterior division gives off sensory and motor innervation, and the anterior division runs downward medial to the lateral pterygoid, and will supply medial to the lateral pterygoid, entering between the two head of the lateral pterygoid muscle, binds on the upper head of the lateral pterygoid muscle and upper head of the lateral pterygoid muscle, and will enter upper head of the lateral pterygoid muscle and will enter into the anterior border of the emerge on the anterior border of the ramus of mandible, and will supply the temporalis. So this is called the temporalis, and this whole is called as the buccal nerve. Okay, so that they will supply the temporalis and temporalis sensory innervation. So, and at the same time the masseter comes on the body of ramus of mandible, and it will supply the masseter nerve, that is mesencephalic nerve, will become the mesencephalic nerve, and mesencephalic muscle will be supplied by it. Now comes on the anterior lateral direction. It will in the anterior and the lateral direction it will run. Okay, in the anterior and lateral direction it will continue its movement, and at the level of second and the third molar it will go and supply the molars, and will come across in front of the. So they think that lips is also covered. Okay, but it doesn't happen. So we should remember that the buccinator, lower lip and the corner of the mouth, both the area will not be supplied by the buccal nerve. These things to be remembered. In the second video we will continue with the another branch which is called as the posterior division, which is the very longest branch.